Hello, I'm Dr. Jacqueline Small, President of the Royal Australasian College of Physicians. I would like to acknowledge the Gadigal people of the Eora Nation as the traditional owners and custodians of the lands I'm speaking on today. I extend my respect to all Aboriginal, Torres Strait Islander and Maori people. Together, we restate our shared commitment to advancing Aboriginal, Torres Strait Islander and Maori health and education as core business of the RACP. We've known for decades that we live in highly inequitable societies when it comes to enjoying good health. The health inequities experienced by Indigenous Australians and Māori in Aotearoa, New Zealand are well documented. For example, an Australian burden of disease study found that in 2018, Indigenous Australians as a whole lost almost 240,000 years of healthy life due to ill health and premature death. That's equivalent to 289 years for every 1,000 people. The recent pandemic has highlighted just how widespread health inequities are across all of our communities. You are more likely to die from COVID-19 if you have a pre-existing health condition, and rates of those conditions are elevated among the poor and marginalised. There is unequivocal evidence for the effect of broader health inequities caused by socioeconomic determinants of health. Many of you will be familiar with the groundbreaking Marmot Review in England in 2010. It advocated giving children the best start in life, enabling people to have control over their lives, fair employment, healthy standards of living and sustainable communities, all to ultimately improve health outcomes. 10 years on, Sir Michael Marmot has revisited this topic. His findings are sobering. For the first time in more than 100 years, life expectancy has failed to increase across England, and for the poorest 10% of women, it has actually declined. Over the last decade, health inequalities have widened overall, and the amount of time people spend in poor health has increased since 2010. Mortality rates are increasing for men and women aged 45 to 49. Child poverty in England has increased, 22% compared to Europe's lowest of 10% in Norway, Iceland and the Netherlands. We're seeing similar trends here in our two nations: health crises, insufficient money to lead a healthy life, and increasing child poverty. Health equity is a critical principle that underpins all of our college advocacy work. Health equity is one of 6 foundational principles of the 2022-2026 CPAC plan. We developed a submission to the Australian Treasury's first round of consultation on their new Measuring What Matters statement a few months ago. In Aotearoa, New Zealand, Make It the Norm is a set of policies and recommendations to make health equity the norm by 2040. Our Indigenous Strategic Framework aims to improve the health and well-being of First Nations people in Australia and Aotearoa. However, racism has been under-recognised as a determinant of poorer health. Nada Hamad, RACP Fellow and Haematologist, writes about structural racism. She says the current socio-cultural pressures to re-examine structural racism in society and in medicine have inspired researchers to question the assumptions that underpin clinical research and to ask about disparities in health outcomes. Further, she contends that an intersectional approach that does not solely focus on race, but on other intersectional characteristics such as gender, disability and so on, is likely to be the most efficient way forward. It is becoming clearer that our health systems also contribute to health inequities, with researchers such as Hamed et al. Reporting the impact of racism in healthcare. Wasserman et al. In 2019 wrote of healthcare being an integral determinant of health disparities. These researchers looked at health service system factors, quality of care, payment systems, bias, clinical decision-making and patient-clinician interactions. I believe that the socio-cultural pressures that Nada wrote about are also relevant to our college. Our college takes a strong stand against racism. However, it is increasingly apparent that we need to acknowledge the unintended biases that may be experienced by our members. Recent publications by our members are salient prompts to review our own systems, as well as those of the health services we necessarily work very closely with for physician training. Josephine Thomas, 2023, surveyed directors of physician education in Australia and New Zealand and found that selection into BPT practices are heterogeneous and, as such, raised concern for selection bias. Vanaja Sabasan and others, including the president of PCHD, Nitin Kapoor, in 2023 investigated candidates' demographics on the virtual multiple mini interview. Even though the VMMI mean scores were not different across geographic regions, there were differences in being offered training positions. There were also differences in experiences of the quality of the technology. Addressing structural discrimination and racism continue to be especially important to the work of the college. This includes being open to how our own systems and those of the health system our trainees in particular intersect with may inadvertently contribute to bias. I'd like to finish by acknowledging an outstanding physician and strong advocate, Professor Robert Walker, Head of the Department of Nephrology at Otago, who is this year's winner of the RACP College Prize. Rob is acknowledged for his leadership in the field of nephrology and the demonstrable improvements he has made to the lives of people affected by kidney disease. He's advocated for improved kidney care both nationally and internationally. Professor Walker is also recognised as an internationally eminent researcher. He has been appointed the Deputy Chair of the Clinical Research Committee for the International Society of Nephrology and serves on the ISN Research Grants Committee. Rob has been involved in the work of the RACP for almost 30 years. This is an astounding contribution to our college community. He holds roles on the RACP Clinical Examination Committee as external examiner to Australia and participated in the review and update of the nephrology training curriculum. Please join me in congratulating Professor Walker and thank you for watching.